right, now we're ready to have some consultation. Find out exactly what's happening. If you're a woman and you've been having all these hormonal changes and you haven't gone to the hospital yet, we're going to keep you updated on what might be happening in your body, and that would keep you informed. And then now you can go to the hospital. So the doctor, I'm feeling A, B, and C, and I'm thinking it has to be A, B, and C, right? Right. Okay. But let's use this opportunity to say good morning to the Bank Hospital, and thank you for supporting the morning show. The Bank Hospital is the one place you want to go if you want to get your health checked out. Guess what? I got my new glasses from the Bank Hospital. Their services are legit and they're really cool. So you should get to the Bank Hospitals at Cantonment near Nafti, or you can also call them on 030-273-9373, 030-273-9373, and you can call, book an appointment, and get to the Bank Hospital, get your health checked out. All right, so today we're getting into what really bothers women, right? But the reason we need men around is for support systems, right? So that you know what is going on in the body of your woman, and then you can support them all the way through. We're getting into uterine fibroids. Lots of women complain of fibroids and all of that. We want to know what it is and how to actually deal with it. And we have a fine doctor in the house. Dr. Ababiu. Yeah, from Life Healthcare. Yeah, so Dr. Ababiu from Life Healthcare is here to actually teach us, educate us on what to do when it comes to fibroid. My lady, you're welcome.
Hi, Diadela. Thank you. Thank you so much.
You're looking great.
Following your footsteps.
Thank you. Thank you. All right, so now let's get into it. Fibroid. We've seen lots of women complain about this thing. What is fibroids? I mean, when I was discussing about this thing with a few friends, they tell me, oh, it's nothing serious. Also because they feel like, okay, it's not cancerous, you know, so it's benign or whatever they call it. And so it's not a huge problem. But you realize that lots of women have been diagnosed with this thing. What are we getting wrong? First off, what is fibroids?
Okay. So uterine fibroids are growths in the uterus. We know the uterus is the womb of a woman.
Okay.
And these growths are non-cancerous. It means it's not cancer. Some people think that, oh, when you have fibroids, it means that you're going to have cancer. But then it's a different, it's different. I mean, 99% of fibroids are not cancerous. There's a 1% chance that, yes, some fibroids can be cancerous, but then most of it are not cancerous. And when we take the uterus, that's the womb of a woman, we have parts. We have the inner part, we have the middle part, which is mostly formed by the muscle, and then the outer part, what we call the serosa. So that's what separates the uterus from other organs. Now, we find that most of the fibroids are from the muscular parts. So it's an overgrowth of the muscle cells.
Okay.
And then it can come into the cavity. So you can have the fibroids just under the inner cavity, what we call under the endometrium. Yes, we call that submucosal fibroids. You can have some within the muscle. We call that intramural fibroids.
Okay.
And then you can have it outside, as is being displayed here, just underneath the outer layer. That's what we call the subserosal fibroid.
Subserosal fibroid.
And then you can have some hanging from the uterus, like an apple on a tree.
Oh my God.
And that's what we call the pendaculated. The most common ones you have in most female is the intramural, the one within the muscle of the uterus.
Okay.
Yes. The least common is the pediculated ones. Yes.
Right.
And it's very common. It's said that up to 80% of women would have fibroids in their lifetime. You get it? And it's most common within the reproductive age. That's 25 to 45 years of age.
Right.
Yes.
So if I get it right, our body is supposed to be normal without any of these things. So the moment there seems to be some sort of a growth, right, around our uterus, and it's in places close to the womb, right, then we are looking at fibroids now. And most of them are not cancerous, but some of them might come up cancer. What would ever make it cancerous?
Well, is the genes, so it can we call it transformation, malignant transformation. So as the cells are growing, sometimes you can have that transformation from being a normal cell into an abnormal cell. You know, cancer comes about when what is supposed to regulate the growth of cells it becomes abnormal. You get it? And there are so many factors. We can't really put our hands to it, but there are so many factors that can cause something to be cancerous.
Right.
Yes. But then the chance of a fibroid becoming a cancer is very, very low. Okay. Very, very low. It's
I see. I see.
Yeah.
Great. But what did we do to ever get here? I mean, we could be women, have children, live our lives. Then you hear fibroid. Some people actually even feel like, okay, it's pregnancy. And over some time, they go and then they find out it's fibroid. What causes these things? What are we doing wrong?
Okay, so I mean, the causes, again, like most medical conditions, has not really been identified, but then there are risk factors. Those are things that will increase your chance of having the fibroids. One, first off, is being a woman. So,
God.
Unfortunately, yes. So there's a hormone, estrogen. There are hormones that are particular to women, and most commonly is the estrogen and progesterone. Now, once you have those hormones, it can increase your chance of getting the fibroids.
Okay.
Now, under the hormonal factors, first off, when you are exposed to the estrogen for a long time. So if you have an early menarche is the age at which you have your first period as a woman. So less than 10 years, if you're having your periods less than 10 years, you are exposed to, you have a risk of getting the fibroids. Two, still under the hormonal, is what's nulliparity. That's a woman that has never given birth before. And here, there's a lot of myths going on. So someone will come and tell me that, oh, I heard that because I'm not pregnant or I've not had a child yet, I can get fibroids. And so people are using that to
actually have a lot of sex.
Yes.
Be careful now, my lady.
I want to demystify it. It's actually not true. But yes, I mean, you're not conceiving yet increases your risk of getting the fibroid because you are exposed to the estrogen for a long time. And when you get pregnant, usually these hormones go down a little bit. And so your exposure to the hormones reduce. Yes. So that's how come like an nulliparous woman can have an increased risk of getting the fibroids. Again, family history, and this is usually direct. So if my mother had fibroids, there's a risk. There's a risk, not like that I too would have fibroids, but then there's a risk, or maybe your sister, there's a risk factor. And then we come to diet. So research has shown that there are some diets that contain some chemicals that mimic estrogen. And yes, we call it phytoestrogens. And commonly, we have the processed foods. So most foods that are processed, or red meat, yes, has high level of these chemicals.
Take me through processed. When you say processed food, are we talking canned food?
Exactly.
Because every food actually goes through process.
Yes. So most foods are processed. Yes. And one thing that we are mostly concerned about is foods in plastic containers, because sometimes yes,
guilty.
We are all guilty, actually. Yeah. I mean, it's just God that keeps protecting us.
We'll do Thanksgiving this Sunday.
A number of things we are exposed to, especially in our time and age. That's how come now these things are on a rampant.
Right.
The plastics tend to contain these estrogens, and then when exposed to heat, you microwave food and these plastics, you can just get into the food. You're increasing your hormonal levels, and then you can be exposed to getting the fibroids.
So it's not even about the food itself anymore.
Oh, no.
It's about the things that are around it, how it's packaged, how it's processed.
Exactly. exactly.
and all of. So that means that our manufacturers also need to get the memo,
Yeah,
right?
yeah,
Because I mean, if women consume what you are producing, of
Yeah.
which I mean, we form like the largest population. You want to be very careful.
Yeah.
And I'm very sure that I mean, if we research, there are things that we can replace
Yeah,
in
yeah,
our
most
processing,
organic foods,
right?
exactly.
That will make it less
Exactly.
maybe chemical.
Yeah.
And make it more organic. Is
Yeah.
that why you've been advocating that we eat more veggies?
Exactly,
Okay,
exactly. So
okay.
veggies are very healthy. Yes, they
Right.
contain the right amount of the elements that you need. Yes. So,
Wow.
yeah.
Okay, my ladies, this is what we're learning. We are learning about fibroids. We know lots of people have crazy things thinking about the fact that you don't have a baby yet, or maybe you had a baby too early or something like that, but we're demystifying all of that. If you don't have a baby yet, it doesn't mean that you should go and have a baby because you might have a fibroid. Please, let's do it the right way. You can get married and then have your child and all of that.
Yeah.
Well, but is it curable?
Yes, yes, it actually is. I mean, okay, so before we get into the treatment, looking at how a woman would know that she has fibroids, the common symptoms that usually come with it. First off, the commonest you would have is the menstrual cycle, abnormalities in the menstrual cycle.
Yeah.
So one of the commonest is heavy bleeding. So you know that typically women can bleed for 3 to 7 days. That's the average. And then we have different cycles. We have from 21 days to 35 day cycle. When I say the cycle, that means the time it takes for your period to come, and then the following month, or the number of days it takes. Yes. So you realize that you start bleeding more than usual. And I'm saying this as a question. It's not every heavy bleeder that would have a fibroid.
Okay.
There are some women that have the 35-day cycle. So those women tend to bleed a lot. Because imagine, I've bled first day 1, and then I have like 35 days for the lining to come back again. And so it will be definitely thicker than someone that has a 21-day cycle. So that's the normal anatomy behind it. But sometimes you realize that if I'm bleeding for 4 days, but recently I've realized that now I'm bleeding for about 7 days, more than usual. I'm using more pads in a day, and now the blood is coming with a lot of clots. It's very unusual to what I'm exposed to. It's something you would want to get
Go
checked
to the hospital
about.
Check it
Yes.
out.
So that's the heavy bleeding.
Heavy bleeding.
Now, we have what we call the mass symptoms. You know, like I said, is in the uterus. And then as the fibroid grows, you can have your abdomen distending. So people will think that, oh, you're pregnant, and that can be very frustrating because you know you're not pregnant, but everybody is asking you, hey, what is happening? When are you going to give birth? I mean, this is different from...
Naturally, when women are bleeding, I mean, when we're going through our cycle, what happens is that there's a bit of protruding.
Lutein, yes, that's
right?
normal, exactly.
It's regular?
Normal. Yes.
Right, so when it looks a lot abnormal.
Yes.
That's when it is. So it's not everybody who is big bellied.
That is just parts. Sometimes you can actually feel the lump inside. So there's an interesting case that someone came, I think she was in her late 20s. Her complaint was that her jeans was no more fitting. Like she tries she tries to close it, and then it's not closing.
The flat tummy goes is not working.
I know. Yes.
Wow.
Yes.
And then that's how she realized that she started to have fibroids.
And then we realized that now there's a mass inside. Sometimes you can actually feel it. In your lower abdomen.
Wow.
Yes.
Is there a way that we could examine it? I mean, if you're home, you could just pass your hand.
Like go through every quadrant, the lower quadrant.
What should we expect to feel if we were regular?
You'll not feel any mass. You
right.
get it. There's no way you feel anything in your lower abdomen because there's a doctor that would be able to tell that, okay, this is the uterus.
Right.
But you would typically not feel anything. But then you know your body, and then one day you wake up and you're feeling something. Initially it was not too big, but you realize that as the months go by, it tends to become bigger. It's something that you'd want to check it out.
I see.
Sometimes it may not even be a fibroid, it may be any other uterine
thing.
mass, but then it's just good that we check it out, make sure we diagnose it properly.
Right.
Yes. Yes.
So bleeding.
Yes, and then the mass symptoms. So when it comes to, again, with the mass symptoms, you know, the bladder is in front of the uterus.
Right.
And then the rectum is behind it. So depending on how large the fibroid can get, it can actually impinge on the bladder. So you tend to have increased urination. Like I urinate, and then 5 minutes I want to urinate again. Yes. And then
Because pregnant women also face that
exactly,
sometimes.
because there's something in the uterus.
Right.
You get it. So now there's something in the uterus, but it's not a child. Yeah.
Oh my God. Every fibroid will become a fine boy in Jesus' name.
Amen.
Yeah.
Yes, and then when it impinges on the rectum, that's behind, that's when you can have constipation.
Okay.
Yes. And then
I see.
moving on to, from that, we can have pain. You can have pain in the lower abdomen, worsen when you're having your period. So people with fibroids tend to have very painful periods. Yes, very painful periods. And then you can also have lower back pain as well.
Okay.
Yes. Yes.
I see infertility. Aside the fact that it makes you look as though you are pregnant, it also prevents you from getting pregnant.
Yes. So, you know, the uterus is what houses the baby when the baby is being formed. And the baby needs the whole room to be able to feel free, grow normally.
Yeah.
Now, if there's something in the room, it will be difficult for implantation to occur. That's the baby to be properly positioned for the pregnancy to take its natural course. So, yes, it doesn't mean that when you have fibroids, it's a cast in stone, you're not going to get pregnant. The risk becomes a little difficult because of what I'm explaining. Because now the fertilized ovum would go there, and it's not really getting a place. Depending on the number, depending on the location,
Right.
yes, it will not be able to implant properly. So that's where the infertility comes in. So
Does it have any effect on babies? Okay, if you have the chance
Pregnancy.
to get pregnant and then
Yeah.
there's a fibroid, does it?
So-
Because I'm thinking it's fighting with the baby, right?
So that also depends on the position of the fibroid.
Okay.
There are people that may have fibroids and can still have a normal pregnancy. It wouldn't increase, it wouldn't cause any issue, not at
Okay.
all. There are some too that would have the fibroids and the pregnancy and will tend to come in with a lot of pain because of mostly the pedunculated ones, because they will be contracting, it's twisting on its stalk.
Oh, no.
So yes, so there are little complications with that, but we can manage it. We are very concerned about those ones. So when you're pregnant and you have fibroids, especially depending on the number and the location, we tend to pay closer attention to you. But there are some people too that will have it's normally, there will be no issue at all.
Wow.
Yeah.
That's why we need to go for antenatal. The moment you feel like, okay, I'm pregnant, I'm feeling something strange, why not? I want us to continue with the symptoms, right? We started with heavy bleeding, prolonged bleeding also, infertility, inability to pass urine, right? That's where it is.
So when it blocks the urine flow.
And then it also makes you want to do it frequently.
Exactly.
How is that even working? I mean, I want to do it frequently, but I can't do it.
So it starts off by exerting the pressure on the bladder.
Yeah.
And once the pressure is exerted, the bladder will want to expel the urine. So that's where the frequency comes in. You get it? Yes. But it can grow so big that now it's impinging on the tubes, the ureters, because they are all in one region. They are all in the pelvis. Yes. And when there's a blockade, you cannot
Pass
urinate,
urine.
and then now you would have a backflow of urine into the kidney, and then the kidneys. So all these are complications of.
Oh no, oh no, oh no. Well, let's get back to that. I mean, by way of education, I want us to exhaust all of these things.
Yeah.
Says inability to pass urine, so we've been there, constipation, we spoke about
Yeah.
it. Feeling a lump in the abdomen, so that's how we can actually run our fingers there to see. Painful periods, pain in lower abdomen. Is it during periods or even after that?
So commonly during periods.
During periods,
Yes, but
okay.
sometimes even when you're not menstruating, you can have the pain.
Okay.
Yeah.
And then the one that you spoke about, the baby in the uterus and then fighting for same space. Is that the pregnancy complications?
Yeah.
Okay. So these are the common symptoms of fibroids. Abortions.
Yeah.
Abortions?
Yeah, so that's for women trying to conceive. So you realize that a woman may come to you that I've been having early pregnancy miscarriages. So I get to 4 weeks and the baby comes out.
It's not spiritual.
It's not spiritual. I mean, yeah, we can have those ones.
Okay, I mean,
but then
don't fight the church girl now. Huh?
But then sometimes when we do the scan, you realize that where the fibroid is competing with the implantation process.
Okay.
So the abortion is just like the ovum or the fertilized embryo coming out.
Like that's giving up. Yeah. Why would an embryo give up when we need the baby?
Yeah.
But this is it. Today we're not going to be taking phone calls. On Thursday, you have the free will. You can call in and ask all the questions that you need to ask about fibroids. Probably you're seeing some of these things happening to you. It might not be it. Other factors might contribute to it. So why not ask any questions about fibroid or any other thing that is bothering you? Keep it locked on Thursday. That's what we're going to do, right? Right. Okay.
Yes.
Now that we've looked at the symptoms and all of that, back to my question.
Yeah.
Curable?
Yes. So it is curable. When it comes to the treatment of fibroids, it's usually a discussion between you and your doctor as in what the goal is.
Okay.
So it's not every fibroid that would have symptom. Do you get it? So we may be having fibroids, but you do not know.
Blood
you will not know.
This is an African girl. No. You cannot come close to my doorstep.
Yeah, because you are not showing anything. Right. It can be as small as a seedling. You get it? And it can get as big as a watermelon. Yeah. Yes. So depending on the size, the location, the number, you would want to do something about it. If maybe you went to do something and incidentally we picked a fibroid and it's very small and you are having no issues with it, it's better to leave it like that. Sometimes it will not worry you at all.
Okay.
Yes. But then if it's causing issues, maybe I want to get pregnant, I've been having these miscarriages and there's fertility reasons, then we would want to do something about it. So when it comes to, and for some people, it may just be for cosmetic reasons because I want to have the flat tummy. Yeah. Yes. So, and it's very uncomfortable when people keep asking you, hey, when are you going to give birth? And you are not, you're not pregnant. Yes. So all these things are put in place. Now, we can have medical treatment and then the surgical treatment.
Okay.
So with the medical treatment, mostly is for the symptoms of the fibroid. So like I said, most people tend to bleed a lot. So we give them medications to stop the bleeding, to reduce how much you are bleeding. One of the common medications we use is oral contraceptives. It helps to control bleeding, yes. And then aside those ones, let me mention that when you bleed a lot, you can become anemic.
Right.
Yes. So you tend to realize that now you're getting tired easily. Your heart is beating fast. You can't be able to do what you're usually able to do.
Level is low.
Exactly. Yes. So usually we want to control that so that you do not become anemic. And then there are some medications. No one asked me, the doctor, can't you just give me something so that these things will shrink?
No, please.
So yes, we have the GnRH agonist that we give to shrink the fibroids. But then these would only work as long as you take it. So we usually would give it to shrink it a bit and then probably go in for a surgery. The medications will not take it away.
Oh.
Yes, yes.
So even if you start from medical solutions to it, it will end up in surgical?
Sometimes.
Right.
Sometimes, yes.
Right.
Sometimes.
That's scary.
Yeah.
When I hear surgery, I'm thinking they're going to correct me up.
So, I mean, in the past, people used to think that, oh, once you have fibroids, it means that you are going to do surgery. That is, we are going to open and then take. There are two types of the surgery. There's the one that we take the womb out. So, like I showed in the pictures, you notice that there were growths around.
In different parts.
We take every one, you take it out, and then close it up again. That's what we call the myomectomy.
Right.
And then sometimes you can actually take out the whole womb, hysterectomy. Yes.
So if you do the hysterectomy, that's it for life?
Yes. And usually those ones are done for people that do not have fertility wishes. Yes.
Is that not the reason the girls want to now have a baby before they take the womb out and
exactly.
finally want to
but
do
then,
that?
So that was in the past before a lot of advances.
Right.
Now there are a lot more surgical advances. There's something we call the uterine fibroid embolization, where it's also surgical, but it's minimally invasive, where an artery from probably your groin area, that's the femoral artery. So we'll inject something, we'll inject it through to your uterine artery. That's the artery that feeds the uterus.
Okay.
Yes. And then some chemicals will be injected to block the blood flow to the fibroids. So then it would shrink. There was a case I heard where the woman had, the fibroids were so large, about 20 centimeters. Like a 5-month pregnant woman. Let me just to put. And then she said she went to a facility and they told her that for this, the way it's taking the whole womb would have to take away the uterus. So that's the hysterectomy. And she had not given birth. She didn't know what to do. And she explored other options.
Right.
And then she was told, okay, we can actually do the UFO for you, and then we'll see how far it goes. So she said she did it the first month, and it came down to 10 cm.
Oh.
Yes. And then I think she had 2 cycles of it, and it came to about 6 cm. And now we could take it out, like by a simple myomectomy.
Wow.
Yeah.
Wow.
Yeah.
Okay, so what are we looking at?
So this is one of the procedures. This is a laparoscopic ultrasound. So it's not every surgery that sometimes we call it open surgery. Sometimes through a little device, you can actually go through like we are saying, go through the abdomen, get to the uterus, and then just take the fibroids out. Yes. Yes.
Hey.
I mean, there are a lot of advances now, so don't let anybody lie to you that, once you have fibroids, it means they are taking away my womb. No.
Let's get to, because we're talking about medical stuff, herbal medicine. I have heard it time without number. How people, look, one medicine in Africa can do a
lot of things.
Look,
yes.
It's a magic potion. Even when you take it, you have bad dreams, it will go. Medication will take bad dreams away. So I want to ask, because these are some of the things that you hear mostly when you're public transport. This one takes about fibroid, diabetes. I don't know how they mention it in Kenya and all. I am shishi and But what can we do when it comes to these herbal medications? Would you advise it? Is it good for it? What's your stance?
So, we've not come across any herbal medication that can actually melt the fibroids, like it's published out there. Because even when you realize, I was talking about some medications that can be used to shrink it, yes. But you see, when it comes to the herbal preparations, the reasons why we don't usually talk a lot about it or recommend it is because, one, we are not sure of the constituents of the medications.
Right.
We don't know how much, even if the mechanism of action is like what I spoke of, the GnRH agonist. You are not sure of the quantity.
Right.
You are not sure of how it was made, the processing. You don't know whether the person went to fetch it from the backyard and not wash their hands. So when it comes to herbal preparations, we do not recommend it. We do not recommend it, yes.
Well, I know that you've taken some medications. You've
Yeah.
tried some herbal medicine. I mean, even you chewed some of the leaves. It's okay. Stop it today because you heard the doctor, okay? But if you still have doubts, it's okay.
Yeah.
You can call us on Thursday. Let's iron this thing out. Let's, allay your fears. Let's talk about exactly what's wrong with you. And let's see how the doctor can help you so you can go to a facility and get it all sorted out, okay? You can check us out on our socials and drop your comments right there. It's My Dominion TV on Facebook and YouTube. Send us WhatsApp messages to put the numbers there. And then all of that so that we are in sync. We want you to be healthy. Right? Because you're important to us. Right. So, Doc, before we go, so we've looked at what it is and the symptoms and treatments. Is there a way that, as a woman, I can prevent before it even pops up?
Yeah. So, basically, being healthy. Being healthy. So, one, let's start from the diet. So like I mentioned, we can reduce our processed food intake. Let's tend to eat more fruits and vegetables, organic foods, and reduce the
the way I'm looking like I'm no, I just feel yeah.
Yes.
Okay, so like the night, there are certain foods that we eat at night. Some street foods. I don't want to go there. Yeah.
You can reduce those ones.
Right.
And then red meat. You can do more white meat. Okay.
What is the difference? I mean, this is me. I'm going to the market. Give me red meat. The one doesn't know what it is.
The common white meat that we have is your chicken. Yeah, chicken is white meat. The red meat, if you realize, they tend to have more blood in it, like the cow meat. Yes, those ones tend to contain a lot of these chemicals that can mimic estrogen.
Okay.
Yes. So
I see. So chicken, more chicken. Is pork parts? We anointed it too.
Pork? I mean,
you anointed pork and changed the name. Why are you making it red meat? Why is it supposed to fight?
So, pork has a lot of fat. Right. And again, when it comes to the diet, you want to reduce a lot of fat intake.
Okay.
You get it? You don't want to take foods that have polysaturated fats in it. Because fat is also a risk factor. I didn't mention it. But you tend to have more fibroids in people that tend to be obese because they have a lot more fat. Because there's something in the fat, not to scare you, that
nobody
easily
can call me fat, right?
Oh, you are not.
I'm not. Yeah.
That can be easily converted to estrogen.
Right.
So people that tend to be heavier tend to have higher levels of estrogen compared to the slimmer ones. Yeah. So
does exercise help?
Exactly, because then you're burning the fats and then you're keeping fit. Yes.
Okay.
So exercise also helps.
Keeping fit helps. Not going to the gym and taking videos. Doing actually the job. Right? Today I'm throwing a lot of shit. So you have no idea. I see. So exercise, eating right, more vegetables, more organic food.
Not taking alcohol. Alcohol is also another risk factor.
Oh.
Yeah.
Wow.
The reducing sugary food. So these things tend to increase inflammation. Inflammation is what would normally cause these growths that I'm talking about. So you want to reduce these things. And you realize that as you are doing this, you are even preventing yourself from developing other conditions.
Very, very true.
Yeah.
So you want to exercise for real. You want to eat right, do more veggies, do more organic food, and less processed foods or canned foods. And then how does water help in all of this? Water helps?
Drinking,
Does it help?
I mean, yeah, so drinking water helps to flush out more toxins from your body.
Okay.
Exactly. So it's good to be adequately hydrated always.
Always.
At least in a day, you should take at least 2 liters of water, at least.
I see. Have you drunk water today? I haven't. Confession. I'll drink after this, okay?
Great.
But there it is. So fibroid might look like a big thing, but I mean, with a little education, look at where we are. Now you know that it's not malignant, right? It's we can get to the hospital, we can get it checked out. It's at different places. There's not necessarily the need for an open surgery where they cut you up and all of that. There's something small can be done to actually reduce the size, get it out of your system.